Wonderful. Let's explore a sensitive yet incredibly important topic: the warning signs of a senior citizen's final year of life. Don't scroll past this. You might think that death comes suddenly in old age, but the truth is the body often sends silent warning signals, sometimes even a year in advance. The problem is we often overlook these subtle signs, and by the time we look back, it's too late to prepare to cherish those final moments. I want to share with you the story of the Thompson family. Eleanor Thompson, a strong and independent woman, was always the pillar of her family. But last year, her children and grandchildren began to notice small changes. She ate less, was frequently tired, and sometimes forgot simple things. They thought it was just a sign of old age, nothing to worry about. But then, things got worse. Eleanor lost weight rapidly, was frequently sick, and started to become confused. By the time the family realized the seriousness of the situation, it was too late. Eleanor passed away just a few months later, leaving the Thompson family with endless regret. They wished they had recognized the signs earlier, to have given Eleanor the best possible care, to have created more meaningful memories. The Thompson family story is a wake-up call. We can't prevent death, but we can prepare for it. We can recognize the signs so that we can love and care for our loved ones in the fullest way possible during their final moments. In this video, we will explore 5 important signs that often appear a year before an elderly person passes away. Some may be things you've already noticed but dismissed. Others may seem minor, but actually signal a gradual decline of the body. Recognizing these signs early will give you the opportunity to provide better care, cherish meaningful moments, and most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end of the video, because these 5 signs can help you prepare emotionally and practically for what's to come. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time you have left with your loved ones. One of the earliest and most obvious signs that a person may be approaching their final year is unintentional weight loss. At first, it may seem insignificant. A belt suddenly needs to be tightened, clothes seem looser, or appetite diminishes. Many families dismiss this as just part of the aging process. But the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients effectively. Muscle mass is decreasing, and essential systems are slowing down. Natural aging does lead to some muscle loss, but when it happens too rapidly, it's a signal that something deeper is going on. The body may be having difficulty digesting food properly, or the person may no longer be able to process protein efficiently, leading to muscle wasting. This loss of strength not only makes movement more difficult, but also increases the risk of falls, weakens the immune system, and makes the person more susceptible to infections. Another reason for weight loss in the final year of life is a change in appetite. Many elderly people simply don't feel as hungry as they used to. Their sense of taste dulls, food is no longer as appealing, and they may start skipping meals or eating much smaller portions. This isn't just a matter of preference, it's a physiological shift. The body, sensing that it's beginning to shut down, no longer signals the brain to seek food as regularly. The result is less energy, less strength, and a gradual decline in overall health. And then there's the role of underlying medical conditions. Weight loss is a common symptom of chronic illnesses like cancer, heart failure, or kidney disease, all of which may begin to progress long before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to decreased eating, triggering a downward spiral where the body doesn't get enough fuel to sustain itself. Some families try to address the problem by encouraging their loved one to eat more, offering favorite dishes, or supplementing meals with protein drinks. But if the weight continues to drop despite these efforts, it's important to recognize that the problem isn't just about diet. It's that the body is preparing for a deeper transition. At this stage, forcing more food may not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in maintaining quality of life. Consider the case of Mr. George Miller, an 82-year-old veteran. His daughter, Sarah, began to notice that her father's clothes were becoming noticeably looser. George had always been a good eater, but lately he was frequently skipping meals and complaining that food didn't taste as good as it used to. Sarah tried to encourage her father to eat more, but George continued to lose weight. After taking her father to the doctor, Sarah learned that George had late-stage lung cancer. The disease was affecting his body's ability to absorb nutrients, leading to rapid weight loss. What's the takeaway here? Don't ignore the subtle signs. Unintentional weight loss can be a sign of a more serious problem. Take your loved one to the doctor for a checkup and timely diagnosis. If you notice significant weight loss in an older relative, especially if they're eating less, feeling weaker, or having difficulty with activity, it's time to pay attention. It's not just about appearance. It's about the body sending a message, and understanding that message now can help you prepare for the road ahead with clarity, compassion, and ability. One of the most noticeable changes in the final year of life is a profound and persistent fatigue that doesn't improve with rest. This isn't just feeling a little tired after a long day. It's a deep exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room requires effort, and activities that were once familiar, like cooking, dressing, or even talking, become too much. This is not just a result of the aging process, but a sign that the body is conserving its remaining energy. As the function of the organs begins to slow down, the body begins to prioritize what is most important. The heart does not pump as efficiently as before, the circulation is weakened, and the muscles do not receive the same level of oxygen as before. This is why many elderly people in their final months of life feel weak, unsteady, and unable to maintain their previous levels of activity. Another important factor is the slowing of the metabolic process. The body is designed to produce and use energy, but as it prepares for the final stage, that energy is redirected. Instead of promoting movement, the body switches to conservation. This is why a person who is declining may start sleeping more, need longer naps during the day, and find it difficult to stay awake for long periods of time. Some people may even experience sudden drops in energy, where they seem fine one moment, but completely exhausted the next. But perhaps the most painful part of this process is the emotional impact of fatigue. Many older people who were once proud of their independence begin to feel frustrated or even ashamed that they cannot do what they used to. They may withdraw from conversations, avoid social interactions, or stop participating in hobbies, not because they don't care, but because they simply don't have the energy. This can lead to a vicious cycle of isolation, where they stop trying altogether, which only accelerates the decline. For families, witnessing a loved one go from active and engaged to exhausted and withdrawn can be very painful. It is easy to assume that they are just lazy or that they need to try to get over it, but the reality is that forcing activity will not help. The most important thing is to understand their limits, allow them to rest when needed, and make their remaining days as comfortable as possible. Consider the case of Mrs. Helen Brown, 78 years old. She used to be an active gardener, but over the past year, her son, David, noticed that she was increasingly tired and unable to do the things she used to love. She often fell asleep in her chair and complained that she didn't have the energy to do anything. David initially thought his mother was just getting old, but when her fatigue worsened, he began to worry. After taking his mother to the doctor, David learned that Mrs. Helen had congestive heart failure. This condition caused her heart to be unable to pump enough blood to meet the needs of her body, leading to fatigue and weakness. What is the lesson here? Do not ignore persistent fatigue. It can be a sign of a more serious problem. Take your loved one to the doctor for a checkup and timely diagnosis. If you notice a loved one experiencing a deep and persistent fatigue that does not improve with rest, take it as a sign that their body is going through a major transition. This is a time to cherish conversations, create moments of peace, and support them without expectations, because in the end, the most important thing is not how much they can do, but that they feel loved, understood, and at peace. As a person nears the end of life, one of the most noticeable changes can be seen in how they think, communicate, and interact with others. You might notice that someone who was once sharp and engaged begins to forget things more often, has trouble following conversations, or seems disoriented in familiar places. They may repeat themselves, forget names, or lose track of time even if they've never had memory problems before. These subtle cognitive changes can happen months or even a year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a steady supply of oxygen and nutrients to function properly. But as circulation weakens and the oxygen supply to the brain diminishes, cognitive function begins to decline. The person may become more easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they might even have brief moments of clarity followed by periods of sudden confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. A person near the end of life often loses interest in social interactions. You might notice they talk less, are less engaged, or spend long periods just sitting quietly. It's not that they don't care about their loved ones, but their brain is no longer processing emotions and engagement in the same way. Conversations become tiring, noisy environments feel overwhelming, and ultimately, many elderly people retreat into their own world. You might also notice changes in mood and behavior. Some people become more irritable, anxious, or easily frustrated. Others seem unusually calm, apathetic, or indifferent to things that were once important to them. This isn't just a personality shift. It's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations the way they used to. For family members, this stage can be particularly difficult. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to pull them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still sense your presence. Take the example of Mr. Walter Johnson, 85 years old, a retired history professor. His son, Mark, began to notice that his father was increasingly forgetful and confused. Mr. Walter often forgot Mark's name, forgot where he was, and repeated the same stories over and over again. Mr. Walter also began to withdraw from social activities and often sat quietly for hours. Mark initially thought his father was just getting old, but as Mr. Walter's condition worsened, he began to worry. After taking his father to the doctor, Mark learned that Mr. Walter had Alzheimer's disease. This disease was destroying his brain cells, leading to cognitive decline and behavioral changes. What is the lesson here? Do not ignore changes in cognition or behavior. They could be a sign of a more serious problem. Take your loved one to the doctor for a checkup and timely diagnosis. If a loved one is becoming more forgetful, more confused, or less engaged, don't dismiss it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, to cherish the quiet moments, and to focus on creating a safe, familiar, and peaceful environment, because even when words fade, love and comfort can still be felt. As the body begins to weaken, one of the most obvious physical signs is a compromised immune system. You might notice that a person who rarely got sick before now seems to catch every cold, every flu, every minor infection that circulates around. Illnesses that were once mild take longer to recover from, and simple injuries like a small cut or bruise heal at a significantly slower rate. These changes aren't random. They're a sign that the body is no longer able to defend and repair itself as effectively as it once did. One of the biggest concerns is recurring infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families dismiss these as just individual illnesses, but when they start happening frequently or taking longer to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics that once worked quickly may seem less effective. The person may need stronger medications, longer recovery periods, or multiple courses of treatment for infections that would have previously required only mild intervention. This happens because as circulation slows and organ function declines, the body simply doesn't respond as well to treatment. Another overlooked issue is chronic wounds. If you notice that small scrapes, sores, or bruises aren't healing properly or keep recurring, it can mean that blood circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues effectively, making wound healing much slower than usual. Bed sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not managed carefully. What's even more concerning is that infections in the final year of life often don't present as we might expect. Instead of a high fever, an elderly person might just seem more tired than usual, more confused, or less interested in eating. In fact, for older adults, a sudden decline in mental status is often the first warning sign of an infection, even before other symptoms appear. This is why recognizing these changes early can make a difference in how much comfort and support they receive during the end-of-life stage. For families, witnessing a loved one experience recurring infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more course of antibiotics or one more hospital stay will resolve the issue. But at a certain point, the focus often shifts from cure to comfort, ensuring they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medications that only prolongs the suffering. Take the example of Mrs. Patricia Davis, 90 years old, who lived in a nursing home. Over the past year, Mrs. Davis was constantly getting urinary tract infections. She was treated with antibiotics many times, but the infections always seemed to come back. Her daughter, Linda, began to worry that her mother's body was no longer able to fight off infections. After discussing it with her mother's doctor, Linda decided to focus on keeping her mother comfortable and pain-free, rather than continuing to treat her with antibiotics. What is the lesson here? Recurring infections and slow-healing wounds can be a sign of a weakening immune system. Discuss with your doctor whether aggressive treatment is still appropriate. One of the clearest signs that the body is preparing for the final stage is a noticeable change in breathing patterns and blood circulation. You might notice that your loved one is breathing more slowly or shallowly than they used to. Sometimes they might pause between breaths, or their breathing may become irregular, speeding up and then slowing down unexpectedly. Some people experience a gentle rhythmic breathing pattern called Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and long periods of stopping. These changes may start subtly, but over time, they become more pronounced and frequent. Another common sign is weakened blood circulation. You might notice that their hands, feet, or even their nose and ears start to feel cold to the touch. The skin may appear pale, slightly blue, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to the vital organs, reducing circulation to the extremities. It's a clear indication that the heart isn't pumping as strongly as it once did. Some people also experience increased shortness of breath, even with minimal movement. Simply sitting up, talking, or changing position can make them feel winded or out of breath. You might notice they're breathing through their mouth more often, or they may suddenly need to stop and catch their breath while speaking. If they could previously walk across the room easily, but now struggle, their lung function may be declining. In some cases, fluid buildup in the lungs can cause even more difficulty breathing. This might cause a persistent cough, a rattling sound, or even a feeling of chest tightness. Many people assume it's just congestion from a cold, but in elderly people near the end of life, it's often a sign that the lungs are struggling. This can make it uncomfortable to lie flat, and they may prefer sleeping propped up on pillows or in a recliner to make breathing easier. For family members, witnessing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease the discomfort. In some cases, medications or oxygen therapy may provide some relief, but the focus shifts to comfort rather than trying to fix the problem. Take the case of Mr. David Wilson, an 88-year-old former jazz musician. His daughter, Lisa, began to notice that her father was having more and more difficulty breathing, and that his hands and feet were constantly cold. He also began to experience swelling in his ankles and feet. Lisa took her father to the doctor, and the doctor told her that her father had end-stage congestive heart failure and didn't have much time left. Lisa used the time she had left to keep her father comfortable. She read to him, played the jazz music he loved, and held his hand. Mr. David passed away peacefully in his daughter's arms a few weeks later. What is the lesson here? Changes in breathing patterns and blood circulation can be a sign that the body is preparing for death. Focus on keeping your loved one comfortable and pain-free. Conclusion: an embrace of love and readiness. As we close today's video, let's look back on the journey we just traveled, exploring the 5 silent signs that the body often sends in the final year of a senior citizen's life. From unintentional weight loss, a warning of a decline in the ability to absorb nutrition, to extreme exhaustion and weakness as the life force gradually wanes. Together, we have unveiled the veil on cognitive confusion and withdrawal from society, as the mind gradually loses connection with the world around it, and felt the anxiety when infections are frequent and slow to heal, evidence of a weakened immune system. Finally, we listen to the changes in breathing and blood circulation. The rhythm of life is slowing down, signaling an upcoming transition. But beyond recognizing these signs, this video wants to convey a deeper message. That is the mental preparation and understanding so that we can give the most complete love in the last moments. If you notice your loved one is losing weight, don't just try to force them to eat. Find out the cause, consult a doctor, and focus on foods that are easy to digest, nutritious, and fit their taste. More importantly, create a fun, relaxing atmosphere at every meal. When fatigue surrounds, accept their limits. Don't force them to overwork. Create space for them to rest, relax, and enjoy light pleasures. Be a listener, a shoulder for them to lean on. Faced with confusion and detachment, don't try to bring them back to reality. Enter their world, talk gently, reminisce about old memories, and show them that you're always there no matter how things change. Faced with infection, follow the doctor's treatment regimen, but don't forget to take care of their body from within. Ensure personal hygiene, provide adequate nutrition, and create a clean, airy living environment. When breathing becomes difficult, keep them as comfortable as possible. Use pillows to raise their head, open the window for air to circulate, and talk gently to soothe their anxiety. Remember, these signs are not a death sentence. They are a reminder to cherish every moment, to express love, to heal wounds, and to create meaningful memories. It's an opportunity for us to say goodbye, to thank you, and to bless our loved ones on their final journey. Consider the story of Mr. and Mrs. Carlson. Mr. Carlson, a strong and independent man, began to show signs of decline in his late 80s. Mrs. Carlson, his beloved wife, recognized the signs we had discussed and was preparing for what was to come. She took the time to talk to him, share old memories, and express her love. She also made sure he got the best care and always felt comfortable and safe. When Mr. Carlson passed away, Mrs. Carlson was saddened, but she also felt at peace because she had done all she could to make his last days meaningful and fulfilling. What is the lesson here? Recognizing the signs of the end of life not only helps us prepare materially, but also helps us prepare mentally to give the most complete love. So, take time for your loved ones. Listen to their stories, share your memories, and let them know how important they are to you. Don't wait until it's too late. If you find this information helpful, please share it with others. Subscribe to our channel for more helpful videos on health and elder care. And don't forget to leave a comment below to share your thoughts. Your support motivates us to continue creating valuable content. If you notice these signs in your loved one, remember that you are not alone. There are many resources available to help you and your family on this journey. Talk to your doctor, seek support from home health or hospice organizations, and seek emotional support from family, friends, or support groups. And most importantly, remember that love and comfort are the most precious gifts you can give in these final moments. Thank you for watching this video. If you found it helpful, please like, share, and subscribe to our channel. Your support helps us continue to create valuable videos like this. And don't forget to turn on notifications so you don't miss any future videos. We look forward to seeing you in the next video.